Good morning, doctors. Welcome again. Today we are going to discuss about Hashimoto's thyroiditis. As we already discussed hypothyroidism, and hypothyroidism is also due to Hashimoto's thyroiditis. So guys, let's discuss here. And those who are not watched still hypothyroidism lecture, please go through and watch it. Then this lecture. Due to autoimmune destruction of thyroid gland. What is Hashimoto's thyroiditis? It's an autoimmune destruction of thyroid gland which is responsible for decrease in T3 and T4. Hashimoto thyroiditis is more common in female as compared to male, 15:1 ratio. The onset here is 30 to 50 years. 30 to 50 years of age. It is mainly associated with autoimmune diseases like SLE, systemic lupus erythematosus, rheumatoid arthritis, primary biliary cirrhosis, psoriatic arthritis, ankylosing. Such autoimmune disorder associated with Hashimoto's thyroiditis. And we need to see the antibodies associated with it like anti-TPO, thyroid peroxidase antibodies, anti-TG thyroglobulin antibodies to diagnose the Hashimoto's. Okay. What was the complication of Hashimoto's thyroiditis as a hypercholesterolemia, anemia of chronic disease? Hyponatremia means decreased sodium level in blood. Myxedema, coma, these are the complications. So as we already discussed in hypothyroidism also, these are the complications. About the myxedema, coma, we are going to discuss in a separate lecture. Okay. Now, what are the symptoms? Symptoms is weight gain, decreased appetite, galacturia, menorrhagia, because when there is increase in TRH or thyroid hormones, it causes prolactin increase, which is responsible for galacturia and menorrhagia. Now, goiter, cold intolerance, lethargy, constipation, these are the symptoms. Now, patient present with enlarged thyroid, bradycardia, cool and dry skin, bitter hair and nails, decreased tendon reflexes. In hypothyroidism, the metabolism is slow, so everything decreases in our body. Now, diagnosis here by TSS. TSS is the most important test. Then go for T3, T4. It's thyroid function test and history of anti-TPO and TG thyroglobulin antibodies. Accurate, most accurate is thyroid biopsy. Thyroid biopsy. Okay. How to treat? Treat by levothyroxine. It doses for your exam point of view not important. It's 20 micrograms, 25 micrograms, 50 micrograms, 75 micrograms, 62.5 microgram, 125 microgram and 100 microgram. So many various doses, and these we can give according to the body weight or according to the TSH level. So guys, I hope it's clear for you till here, and if you like this video, put like on it, and if you have any queries, any comments regarding this, you can ask me, and if you still not subscribe my channel, please subscribe it. Thank you, good day and goodbye. That's all for today.